So the first session is on leadership for high reliability, and leaders matter. All of you are leaders in your organizations, your groups, your institutions, and if leaders aren't there setting examples and organizing for success, then nothing falls into place. So we thought we'd start with that as the foundation for moving forward. I'll share some ideas about team building, and then we'll move on to Dr. Carl Krecky, who is Vice Chair of Radiology at Mayo Clinic in Rochester for most of the last decade and has been leading quality in the department for most of the last decade as well. And then on to Dr. Jonathan Kresko, who's the Chair and a National Quality Leader, Chair at Beth Israel in Boston. So let's look at team building. Over the last 18 months, a group of us at Institute for Healthcare Improvement did some intensive research on high reliability, high impact leadership. And the white paper is available at ihi.org. One of the things we looked at is the new mental models we'll need as we're moving forward to create value for patients. This is driven by many economic factors in our country, first and foremost of which is the Accountable Care Act that has 20 different measures within it. So the ACA is a combination of health insurance reform and effort via 20 mechanisms to improve the quality and paying for value instead of just for volume. So we have this paradigm shift from volume to value, and we're starting to feel that now, but most of the impact of the ACA will be coming in the next years, where we look at persons as partners instead of just at patient satisfaction. We're looking at continuously decreasing the cost per unit of service, productivity, not just adding top-line revenue. Radiology will be part of a team delivering care, not an isolated business entity. And that's going to be a major shift for most of us in this room and in America. And it's going to be uncomfortable. The intent, if it's done well, will be to substantially and dramatically improve the care for patients with better care for more people at lower cost. Brookings Institute did a study published a couple years ago that looked at the valuation of companies in America. So 30 years ago, the valuation of American companies was predominantly bricks and mortar, technology, tangible resources, tangible assets. Today, in the 21st century, 30 years later, the valuation of most American companies is predominantly intangible, intellectual capital, social capital. The biggest part of this intangible asset, which is the valuation of healthcare predominantly, is social capital. Social capital is the trust and interconnectedness of people in an organization. It could be within your neuroradiology group. It could be within the radiology group or practice or department. But what today we're looking at is where we connect in the whole system of care. So instead of bricks and mortar, we're looking at this social connected network of neurologists, neuroradiologists, neurosurgeons, gastroenterologists, GI surgeons, GI pathologists. And we'll be forced to move into this space by extended DRGs, by bundled payments, by ACOs, by capitated reimbursement models, so that radiology moves from a revenue center to a cost, and our role is more still delivering the highest value quality imaging and interventional procedures, but more as a consultant, where we're looking at what's the best way to spend a limited amount of money to get the best outcomes for this patient. Not doing piecework, but looking as a social network connected member of the organization that is trying to drive the best outcomes for our country and keep us or make us as competitive as we can be, with 18% of our GDP going to healthcare, with some of the lowest quality outcomes in the whole Western world of the OECD countries. So that's the big scheme, and we're going to be part of that in a hopefully a very positive way. So during this 25-year period, what was the most profitable company in America? The company is in a business sector you would pick last, commercial aviation. It was Southwest Airlines. Commercial aviation shed hundreds of billions of dollars in recapitalization and red ink during that 25-year period, yet Southwest Air was the most profitable of all of the other high-tech companies, oil, gas, et cetera. The reason was, and there's been extensive research on this, Jody Cattell is one of the primary researchers, has nothing to do with how many unions they had. They were unionized as the rest of the airlines. It had to do with something called relational coordination. Relational coordination is a scientific measurement of how people work together. It's how the captain of the airplane worked with the first officer and the navigator and the air traffic control and the ground crew. And it directly correlated with the most profitable and most successful and safest airlines. Lower racial coordination, you crash more planes, you lost more red ink, or you had more red ink. She used the same tool in healthcare. And when she measured the relational coordination of hospitals or orthopedic units or intensive care units, same thing. Higher relational coordination, the better you got together as a team, the better you worked together in a coordinated way for the patient, the shorter the length of stay, the fewer narcotics a patient needed for pain, the fewer complications you had, and the higher the patient and family satisfaction. We're going to be part of this team more and more as the value-based purchasing and ACOs and extended DRGs evolve in a way that brings us in the integrated team. And the better we do it, the more efficient our business unit, whatever it is, hospital, clinic, medical center, group practice, will be if we can get this right by working together. So we'll look like this with radiologists here and here as part of this web, not as a separate bricks and mortar entity. As part of this white paper on high impact leadership, we put together this framework to look at the domains of leadership that are essential for the best performance. It's driven by persons, the community in the center, and you can see the 6 domains. One of them is this engage across boundaries at the bottom, and that's the focus of this conversation for the next 15, 20 minutes, is engaging across boundaries, which is basically teamwork. You still need to develop capability, shape culture, deliver results, and you'll hear about those later this morning in other discussions. Last year, Nick Sabert published a study, and what he did is he looked at the size of signatures of S&P 500 CEOs on their annual reports. He measured the size and looked for an association between the profitability of their companies. There was an association. What do you think the association was between the size of the signature and the profitability of the companies? It was an inverse relationship. The bigger the signature of the CEO, the more likely that company was to be unprofitable. Smaller the signature, higher profitability. So that's part of the humility and emotional intelligence that the best leaders have. And if we're looking at high reliability, we're looking at creating value for patients, we want to find the right person for that role. My current position at Mayo is a medical director for leadership and organization development. We're a physician-led organization. We have 3,800 physicians across our 6 states and 24 hospitals. And there are 155 key leadership positions. Each of those 155 has a succession pool, and we want to make sure that we have a ready now physician to step in from a diverse pool, diverse ethnically and diverse by gender. So if someone wins the lottery on Friday, we've got someone to step in on Monday. Part of the whole pipeline of developing leaders at Mayo starts with when we hire them on the left, all the way up to our president and CEO on the right. And there are 3,800 docs in there, 155 key positions. In the first 3 years, though, we do 2 things now. At the end of year 1, every physician gets an emotional intelligence assessment. Not to pass or fail, but to see if they're the right kind of person that can engage in working and leading frontline teams and other positions up through the organization. At the end of year 2, they all get a 360 to get feedback from their peers, from nurses and techs and students, and from the people that they report to. Not to pass or fail, but to have an assessment of where they fit into this integrated group practice. So in essence, what we're trying to do is identify physicians who have small signatures. And then at the end of 3 years, we either hire them or we don't. And if they got too big a signature and they can't downsize it, then they go someplace else. Our physician leaders partner with administrators. So we do everything we can to mitigate the we, they, us, them. Our physician leaders are not in any kind of leadership position for more than 8 years. Then they rotate out like the Canada geese do. It's a group effort and it's a team effort for collective leadership. All of our physicians remain in the practice or in research or education, so they're part of the team instead of moving and transitioning to an administrative position and a different career and away from the care of patients. Diversity of gender and ethnicity and of thinking is a key part of building a highly functioning team. A diverse team on a committee, people measure this, has a collective high IQ that's higher than a committee of 7 white men. All of the major orchestras in the world now do blind auditions for their musicians. So if they need another violinist, there's a big curtain at the front of the auditorium, and the violinist who wants a position with the Philharmonic walks behind the curtain without high heels on, so there aren't any clues about the gender, and then they audition. This practice among the world's best Philharmonic orchestras has resulted in a 7-fold increase in the number of women musicians that are selected. Diversity matters for making the right decisions and for having a culture that reflects the diversity of the patients that we serve. On purpose, we appoint a devil's advocate for important decisions. So our management team and board of governors at Mayo, for any major decision on a major capital expenditure or strategic decision, we will ask someone, Lucy, you're going to be the devil's advocate. You take the contrarian position. You make the case why we shouldn't change the direction of the Queen Mary. You make the case, whether you believe it or not, why we shouldn't, invest in the proton beam. So we get away from the groupthink, and we have a highly functional team that's comfortable discussing the best possible option for our organization. This translates into the front line of patient care as well, whether you're making strategic decisions at the top or whether you're making patient care decisions, which are much more important for any organization, to have the psychological safety of all colleagues to speak up, to get the right decision, and to have 24 eyes instead of 2 eyes on all of the information available for making the decision. This is oxytocin, and this is your amygdala without enough oxytocin, light flashing red. If you shake someone's hand, your oxytocin levels go up, and your trust and comfort with them increases. To have a highly functional team at a front line within an organization with multidisciplinary groups of specialists from internal medicine and surgery and laboratory radiology, or between institutions with primary care going up to the transplant unit, you have to get people together face-to-face, shaking hands, working with each other for a high reliability team. Just the addition of the introduction of patients in the operating room before a surgical procedure, so the anesthesiologist and the nurse and the tech and the surgeon shake hands, know each other's names, is a major contributor to the lower mortality of using that surgical checklist before surgery. So the team is comfortable with each other and highly functional. What single thing did this huge call center group do to increase productivity by 12%, increase revenues by over 15 million? They simply scheduled coffee breaks and lunch breaks at the same time, so that the team in one of the worst jobs in the world, these call centers, took a break together and shared a Coca-Cola or a cup of coffee, and then came back. That dramatically raised their productivity and the satisfaction of the clients on the phone. Human beings are social animals, and in running their organization, in building teams that are highly functional, we've got to acknowledge that and facilitate them working together. So back in the 1930s, I think 33, Ed Carlson was a farmer in southern Wisconsin, and he found out that he couldn't make butter from his milk from the cows because it wouldn't coagulate. Turns out the cows were drinking rotten sweet clover, which had a metabolite similar to warfarin or coumarin, and that's the evolution of this anticoagulant that is extraordinarily beneficial, saves lives, but it's also a high-risk drug. When we looked at our use of warfarin across Mayo maybe 6 years ago, we were giving warfarin to 18,700 patients. And we had this high variation environment. We had hundreds of practitioners giving warfarin in what they thought was a competent, reasonable way, but because it was a high variation environment, it was a high defect environment. So we had a defect rate of 3.8%, where the INR was too high or the terminal trajectory was too steep. And we said, we can do better than this. So we looked at all of the practice across Mayo, and we found one positive deviant. In Eau Claire, Wisconsin, at Luther Middlefort, their defect rate was 1.1%. And after we got over the fact that their patients weren't any different or more difficult, or the data was bad, we got down to picking out the best protocol. So long story short, we said we want one best practice, so every patient at every door at Mayo Clinic will have the safest anticoagulation. And today we have a defect rate of 1.1%, which is as low as you can get without genetic testing across all of Mayo Clinic, with a CPOE-activated algorithm that's run by pharmacists. And we hit the trifecta for this improvement activity, which we want to do for everything. So the first part of the trifecta is it clearly improved the safety for patients. Fewer defects, shorter length of stay, fewer bad bleeds. The second is it saved us money because of shorter length of stay, fewer complications. And the third is, of this trifecta for quality improvement, it made the life of frontline workers easier. So remember the old days where we're getting calls every 5 minutes with lab results, and we don't get those anymore. Those are now handled in a routine way, algorithmically, with a pharmacist, and that frees up frontline workers and nurses and docs and students and techs to use their brains for something that is more productive than that can't be handled with an algorithm like that. So this kind of work takes social capital with connectedness and trust in order to diffuse a best practice, and it comes down to building teams that are comfortable with each other, whose primary interest is in the needs of the patients. This movement towards standard work, which is part of the tension of moving to high reliability, where physicians give up some autonomy in order to improve the reliability of their care, can be infectious. So once you reach that square root of n, then things start happening. So 9 years ago, we had 7 different ways to make scrambled eggs at Mayo Clinic. And our chefs saw that our nurses were moving to standardized care, and our surgeons were, and our infectious disease consultants said, it's probably good for us too. So they decided on their own to have a bake-off. And they baked 7 recipes of scrambled eggs, and they picked the best one. So today at Mayo Clinic, we have 1 recipe for scrambled eggs. Standard work improves efficiency, it improves safety, it improves the ease with which physicians and radiologists can go through the day and use their brains for something other than high variation environments. Part of this social movement in any organization requires that each member of the team has some basic understanding of systems engineering, of systems competency. Doesn't mean they have to all be black belts and Six Sigma and Toyota Production System, but all of us need to have some basic understanding of the difference between human factors and errors and risk-taking and individual competency and the role of systems and processes. And so we have this Quality Fellows program that we started 8-9 years ago, and today we have just shy of 35,000 colleagues that have a bronze, silver, gold, or diamond level of competency, which are roughly equivalent to yellow belt, green belt, black belt, and master black belt in the ASQ Six Sigma space, so that our approach and our thinking is more about systems and processes in the context of teams, and it's not just about a bunch of individuals studying harder and trying harder and working harder. That doesn't scale to high reliability. You have to have a foundation of processes and systems and a foundation of basic understanding of our 61,000 employees that this is the most patient-centered way to give care. This is my brother, David. He's a whole lot better looking than I am. He has a lot more hair. He makes a whole lot more money. And he beats me at everything. He's the firstborn, I'm the secondborn. David is the Chief Financial Officer or Chief Investment Officer at Yale University. He runs their endowment. They have a $22 billion endowment, and his performance in the last 27 years there has been #1 in the Cambridge Index. They have outperformed every retirement fund and endowment in the country with a 14.4% annual return for 27 years. That's the best they can do in the finance world. We can do better in quality. So we've published this work with our Chief Financial Officer at Mayo, so it's not a bunch of quality folks making up numbers. And what we can do is guarantee that our portfolio of quality improvement that works to improve the outcome, safety, service, and reliability of our care for patients, we can guarantee a 5-to-1 return on investment, a whole lot better than 14.4%. And our 3-year rolling average, just for Mayo Clinic projects that we administer centrally, doesn't count all the hundreds that we do in the departments, is a $48 million 3-year rolling average hard dollar return on investment for improving the care of patients. So the key message is there's not a trade-off between the portfolio of activity of improving the outcomes, safety, and service of patients if you do it through a systems engineering approach that simultaneously, when you drive out variation, waste, and defects, improves your bottom line and improves the outcomes for patients, not a trade-off. And so healthcare is the biggest business sector in America, 17–18% of our GDP. And you can see in the highlighted circle, it's also the least productive, and we also work in the business sector with the highest error rate, down there with the U.S. Postal Service. To move up in that upper right quadrant, it's a matter of driving out variation, waste, and defect using systems engineering principles that will improve your bottom line and improve the care of patients simultaneously, not a trade-off. Now, there's some projects that cost money and lose money, and some break even, but the portfolio of activity is a business strategy. It's not a necessary expense, it's a business strategy, and it's part of when radiology becomes more and more involved in this big system of care instead of as an isolated part of a cottage industry, that we'll be partners in delivering and moving that circle. So if you smoke weed, it lowers your IQ 8 points, okay? So there's an interesting study done that was commissioned by Hewlett-Packard that was carried out at Rutgers University that measured IQ after a day of multitasking, a little bit of iPhone, a little bit of email, a little bit of PowerPoint, looking at 2 or 3 monitors with 2 or 3 mice during the day. And what did they find at Rutgers University that did to a human being's IQ after 8–9 hours of multitasking in the electronic environment? Lowered your IQ 8 points. Both are temporary, but a very important part of delivering high reliability care is the human factors element. So Thor Sunt is the cardiac surgeon in the middle here, looked at the number of interruptions they had during routine coronary artery bypass surgery and routine cardiac valve replacement in our ORs. And they found dozens and dozens of interruptions. People coming in, beepers going off, getting another spline in, a different aortic valve, more sutures, whatever. And he and a human factors PhD from the airspace industry looked at all those interruptions, used standard work, pre-op briefings, introductions of the teams, dramatically lowered the number of interruptions, and they found a direct relationship between the number of interruptions and the number of medical errors. They dramatically lowered the number of interruptions, the number of medical errors plummeted. And their day was less stressful, and the time between cases and for cases reduced substantially. We published this in surgery a few years ago. Human factors are an important part of our lives, and we look at, I would bet most of the radiologists in this room are working in an unsafe environment with the number of interruptions you have, with the number of mice you're using, with the number, with the way your work unit is set up, and it not only is unsafe, it doesn't help your IQ. So coming down to the end of this first segment here, let me just summarize, put this in context. Engaging across boundaries in our new and evolving healthcare environment, where radiologists are more and more becoming part of an interdisciplinary team instead of an isolated part of a cottage industry, driven by extended DRGs and capitation and accountable care organizations and bundled payments. We will have to more and more look at ways in whatever organizations we're in, inpatient, outpatient, tertiary, quaternary, to improve how we work together, it'll bring more joy to our work, and it'll bring better care for patients. One of the fundamentals of making that happen is working together better as a team within radiology and within whatever organizations you're at. Thank you.